Good morning. This is Dr. Timothy Scott back here at Lifepoint Medical. It is July the 11th of 2022. And I want to say good morning to you and let you know that Lifepoint Medical, we are up and operating at full force this morning and doing real well. And I want to remind you, if you're looking at this video, you're probably a patient of ours and if you got any health problems, we want to hear from you, and we want to hear from you before they turn into something bigger. And that is one of the key principles that I operate off of every day. And it's when people call me, and I've paid a lot of money to have a backup catch system. When you call and you don't get us on the phone, we have 3 lines here, and we have probably 100 to 200 calls per hour. So it's hard, even with me having 3 to 4 people picking up the phone all the time. And actually we have 4 lines, but it's very hard to keep up with everybody. So if you get the robot, use them, okay? Because what that does, if you do it right, it'll open your chart and it'll make it so we can't miss you, okay? And we really just want to get to you quick and get you taken care of if you've got a disease going on. We want to prevent you from going to the hospital if possible, and also prevent you from experiencing the full force of any disease process if we can, okay? And that's our principle we work off of every day. So let's talk about some other things. Let's talk about COVID-19. I'm studying it right now. It does seem like it's picked up around the community. There's quite a few people that we saw last week with COVID. I want to encourage everybody to just continue to use their sanitary practices, mainly the alcohol rubs and using those for your hands. Some people prefer to wear a mask. Some people don't. I'm not sure if the masks are effective. However, if that's what you need for protection, I want you to use it. I can't wear them. They just irritate me so much that it's very difficult for me to use them. But anyway, it seems like it's coming back around. We are seeing people. If you think you've got COVID or you've got an upper respiratory infection, you want to call up here and let us do a televisit with you. And let's do that over the telephone as opposed to you coming in. And if we need you to be seen, we can arrange for you to be seen in our drive-through or something like that, okay? We want to see you and we want to get you taken care of. We just want to protect ourselves and protect our community from this virus if possible, okay? Let's talk about, medical thing I want to talk about today is weight. And we measure your weight with a calculation we call the BMI, which is, and you can Google BMI to figure out what yours is, but what it is it's a comparison between your weight and your height. Okay, and this is what a lot of the studies have been done when it comes to mortality. And we know that your mortality related to obesity factors falls off or levels out at about a BMI of 25, okay? So if you've got a BMI of 25, which mine's like 24, I keep it there, but it's there for a purpose, okay? Then you stay below any of the extra diseases that you'll get if you have a BMI that's higher than that, or you have the potential to have a problem with if it's higher. So if you get a BMI over 30, then that is when you start getting into trouble with high blood pressure and early joint disease or arthritis, things like that. And then if you go over 35, which is considered critical, if you have a BMI over 35, then we really need to be talking and strategize on how to get that BMI down, because the risk of diabetes is off the chart after you get to 35. Now, everybody doesn't get diabetes that has a BMI over 35, but many people do. And just like me personally, if my BMI goes up close to 30, I get full-blown diabetes. So that's why I always keeping my weight down where it is. And I know the challenges of it, and I know the politics of it, and there's a lot of, we're not about fat shaming somebody or doing anything like that. We're about addressing a medical issue and doing the best we can to help you mediate it, okay? And it's not about how people look for me or anything like that. It's just I care, and the way I care is by talking to you about your weight and helping you make it better so that you don't have to suffer unnecessarily. And last but not least, let's talk about Place of Hope. Place of Hope, North Georgia, is doing great. We are doing exactly what we said we were going to do when we started this a few years ago. We've got our executive director out working full-time, or mostly full-time, to help mediate these things and find children that are entering into the foster care system, and we're helping them face to face. And the house that we have, the Place of Hope house, is all funded. We're just waiting for all the craftsmen to finish, and we should be opening around September the 1st. There'll be a fully operational foster care center with an emergency intake center and some places to support our foster families in this community, and provide different services specifically related to DFACS and foster care. So I want to tell you thank you for all the people that supported us in the past, and hopefully you'll continue to help us in the future. We're doing good. We're doing exactly what we said we were going to do, and we're successful because you have helped us, and thank you so much for that. And it is a personal thing when you work in these things and you see what's going on, and hopefully we're going to make a great difference in somebody's life. Well, this is Dr. Timothy Scott Beck. Our telephone number here is 706-782-0016. Give us a call and let us know if you need anything. I was just going to one thing. We don't see these messages. If you respond to this text message, we will not see that. I noticed some people doing that. But if you need us, reach out to us on our telephone at 706-782-0016, or go to our website at drtsbeck.com and ask for an appointment online. Thank you so much for listening to me. You have a great day, and most importantly, you give us a call if we can help you, okay? Thank you.